Okay, guys, can someone say hello back so I know that guys can hear me? Mary, Mr. Leonard, Janet,
Hello.
yay, I can hear you. Hi,
Hello.
fantastic. Good afternoon. Welcome, welcome. I think we'll just dive right in. Again, welcome and thank you for joining. Your time is very important, and we're really, really appreciative that you're joining the webinar with us this afternoon. I think what we're doing here today is we're having a very, very necessary conversation. And this conversation is hosted by Pistis Foundation. Our seminar today is titled Silent Killers, the hidden danger of self-medication and drug abuse, right? At Pistis Foundation, I think our key objective is to empower lives through three core pillars, and that's education, health, and shelter. This is one of our health initiatives. And as part of the our health promotion of efforts, we typically will set up and organize these free health education sessions. The biggest thing we want to do is be proactive rather than always be on the curative side where there's you have the disease first or the illness first. I think one of the key things that we would like to do is change the narrative and focus on a more proactive way. And one of the ways that we see to do that is creating awareness, encouraging healthy lifestyle, and promoting mental wellness and wholeness, right? I hope, sorry, I didn't introduce myself. My name is Sowaria Kosionu. I have the pleasure of being your moderator for this session. Joining me is my co-moderator and colleague, Gordon. He will be helping us guide the discussions and manage the interactive Q&A session. Hi, Gordon. Good afternoon.
Afternoon. Thank you very much, Ms. Suare. Hello, everyone. Thank you for joining us today. We're so glad to have you here to discuss this topic, which seems very, it seems like a literal topic, there's nothing to it, but as we go, we'll see and understand that this could be a life-threatening situation. Self-medication and drug abuse are often misunderstood and underestimated. Many people see them as normal or harmless behavior. Taking leftover medication, popping pills for every pain, or even using strong substances just to cope. But the long-term effects can be devastating to our physical health, to our mental health, to our emotional health.
Yeah, exactly. I think you hit the nail right on the head. Sometimes the most dangerous things are the ones that we don't talk about enough, the ones that happen very quietly behind closed doors. And that's why we've titled this session Silent Killers, because these habits, while they're invisible to others, can lead to irreversible damage. Today, our goal is very, very simple. We want to bridge the knowledge gap. We want to help everyone on this webinar understand the very real risk of self-medication and drug abuse. And more importantly, we want to equip you with knowledge to safeguard your health and those around you. And we have a fantastic panelists, if I may say so, doctors in their own right who have seen it, who are in the center of this epidemic, and we'll be bringing them on shortly. I'll hand over to my co-moderator now.
We have the privilege of having two exceptional speakers join us today. Each will be sharing on their professional experiences and research. First up is Dr. Folake, who will be speaking on the topic of understanding self-medication and its risk. Dr. Folake is a consultant physician, dermatologist at the Department of Internal Medicine at the Lagos State University teaching hospital with years of experience in public health, advocacy, and patients education. Her insight in behavioral health and drug use pattern will help us better understand why people self-medicate and how it affects us more than we realize. Over to you, Mrs. Swari.
Please join us and welcome Dr. Folake as she takes us through this very, very important session. And before she comes on, I think it's very important to us that this session is as interactive as possible. So feel free to start to drop your questions in the question and answer on the chat, and we'll take them at the end of the session. But please don't wait till the end. As the questions come to you, just drop them, and we'll go through as many questions as we can. Dr. Folake, it's your time. Thank you for joining us today.
Good evening, everyone. Am I audible?
Very, we can hear you.
Yes,
Awesome.
we can.
Good evening, everyone. My name is Dr. Folakemi Koladefe. I'm a consultant physician and dermatologist, and I work at LASUF. I'm going to be talking about the dangers of self-medication. As we've heard our moderators talk about, self-medication and drug abuse are two major public health issues that we have across the world, not just in Nigeria, but we have quite a fair share of that here. And so a lot of people actually self-medicate, as we're going to see. And it's not as innocent or as, trivial as a lot of people may think it is. And so we're going to be delving into that and discussing the dangers of self-medication. Now, what is self-medication? It's the use of drugs basically without professional guidance. I'm sure we've all done it, walked into the pharmacy or store and gotten some drugs to use because maybe we had a headache or we had a runny nose, or our child was having, a cough or a flu. And people often self-medicate to manage minor ailments, and that is acceptable to an extent. The WHO does recognize self-medication for minor illnesses but not all medications are safe for self-treatment, and not all conditions should be managed with self-medication. You run the people who do that for inappropriate, or people who engage in inappropriate self-medication run the risk of having improper dosage of medications, severe adverse drug reactions, both short-term and long-term, organ damage, and then drug resistance. Now, again, we want to just talk about, widen the scope of self-medication. Most of us think of drugs, but it also includes herbal and traditional medications, as well as the supplements that a lot of people seem to love so much. And the use of these products or these medications, drugs, herbal remedies, supplements to treat self-diagnosed symptoms, meaning you didn't see any medical doctor or a professional and you just decided, oh, I think I should take this drug. That's what it is. And it's quite prevalent worldwide. It's a common practice, and this map just shows self-medication of antibiotics across the world, and you can see that lots of places are involved in self-medication. It's in the Southeast India region, but recently have shown 70% prevalence of in this part of the world. I hope I'm audible. I hope you can hear me loud and clear.
Yes, we can hear you.
Awesome. So the study says 70%, but I think it's a lot more. Maybe some people in the study were not really truthful, because I'm sure if we do by show of hands, how many of us have bought any of these medications without seeing a doctor or a prescription? It would probably be about 100%, So example of self-medication is, taking anti-malarials, taking antibiotics, antipyretics, as, paracetamol for fever, analgesia for headaches, or skin treatments, creams for skin conditions or sleeping medications without a doctor's prescription. Also, some people use leftover medication that was prescribed. So you went to the doctor, they prescribed medication for you, and then you didn't finish it, maybe some antibiotics. Maybe about a month or two later, you have something else like a sore throat or something. Oh, I have some leftover antibiotics. Let me go back to them. So I don't know if anybody is guilty of that here. And then sometimes you have some medications prescribed to one person and you are giving it or sharing it with somebody else, also self-medication. That person was not properly assessed, but maybe they have similar symptoms to what you had, and you decide, oh, since I used the medication, when I had this problem, I used it. That's remedies and the nutritional supplements and we will talk about the dangers of some of these things that we may not be aware of. So common self-drugs, antibiotics, anti-malarials, as we were in Imalion, antibiotics. So unfortunately, in this environment, you can buy it without a prescription. There are many countries where you cannot get access to antibiotics without a prescription, but that's not the case here. So people just walk to the pharmacy and buy and start using, and that's a problem. You shouldn't use antibiotics without proper prescription. And then for fever, paracetamol. So some people don't realize how dangerous paracetamol can be. And I'll talk about that later. And pain. So everybody, I have body pains. I just take some painkillers before I go to bed. That also can lead to devastating and life-threatening conditions if done too frequently. And then because I'm a dermatologist, I must always talk about skin. Self-medicating for skin condition, we just walk to the pharmacy and buy these triple action creams and stain them on our skin. And, some of these creams contain heavy steroids, and also herbal remedies and concoctions, are used both taken orally and applied to the skin. And we're not really sure of the contents of these things. Now, these are just studies showing some of the common things that people buy for self-medication. Herbal products was actually at the top of the list in this study. Then anti-malarials, then vitamin supplements, azithromycin, which is an antibiotic, calcium supplement. People always say, oh, I need calcium. Calcium can cause kidney stones if abused or used wrongly. I think this study was done during COVID, and that's the reason why we were having hydroxychloroquine and ivermectin, which were thought to be good for COVID. What do people self-medicate for mostly? Sore throats, diarrhea, cough, headaches, muscle pain, fever, cold, and flu. These are some of the common things that people tend to, want to self-medicate for. So why do people self-medicate? I'm sure if we all probably know one or two reasons, but we'll go straight into the drivers of self-medication. The high cost of healthcare medication is one major cause, and this ties into second and third things. So it's cheaper. Self-medication, you don't need to go to the hospital, you don't need to buy a card, you don't need to do tests, pay for consultation and all. And this is because we live in environments where less than 10% of the population have health insurance. Because usually in a lot of societies, these worries should be covered by health insurance. So most people still pay out of pocket for medical care. And that's why self-medication is high, because they don't want to have to pay for all the things I just mentioned. And then it's also convenient and quick. Well, it helps when you have a minor problem, you had a stressful day, you have a headache, just taking some paracetamol and rest is helpful. Or you had a cut and you just apply something on it, So in few instances, it's okay to self-medicate. But if you have a fever or a cough for 3 days or more, ideally you should go to the hospital, see a doctor, and not just go and buy medications in the pharmacy and start using. Then there's issue of limited access to healthcare, which is a problem in some parts of Nigeria. Getting qualified professionals can be an issue. And like I mentioned, buy any drug in this country. sometimes that drives self-medication, because even if you don't need a drug, for the fact that you can just walk in and buy it, you get it. And then previous experience with the medication in the past, you think it's the same problem, so you just use the drug over again. And I've had many experiences of patients doing that. I prescribe them an antifungal for something, they finish the dose, they have something else they think was fungal, and they use that same drug again, but it's not the same thing. And then there's a lot of aggressive advertising on social media for medications, and even the regular media for drugs. So this is also driving self-medication. And with the herbal remedies, our cultural practices and beliefs are a major driver for this. So what are the dangers of self-medication? Misdiagnosis. The individual can be, may not be able to adequately diagnose themselves. And for instance, what like gastritis, they have abdominal pain, and they go and take a painkiller that will even worsen that problem more, because they don't have the medical knowledge to understand that, okay, it's, for instance, I have ulcer pain, and I'll go and take ibuprofen. That's like adding kerosene to fire. And a lot of people do things like that, because they just don't know. And then taking the wrong dosage, because if you are self-medicating, not have been given a prescribed dosage, you might take a wrong dosage, which can lead to the drug not working properly or having adverse effects, or with antibiotics can lead to some distance, so that when you do actually need the antibiotic, it no longer works. Then we also have self-medicating with multiple medications, which can lead to drug-drug interactions. Drugs are chemicals, and there are some chemicals that are not meant to be mixed together. When you mix them together, they produce dangerous interactions or chemicals, which can be harmful to the health. Or they can either make one drug work more, and so the drug is now overworking, or they can stop another drug from working at all. So drug interactions is where your pharmacist, your doctors come in, and when you are prescribed something, they make sure they are not clashing or interacting. Now, also self-medication can mask underlying symptoms. I was watching Instagram today, and I saw a video made by a Poco doctor, somebody who probably had what was appendicitis, was taking painkillers, and that can lead to, a complication of appendicitis. If it's not addressed on time, can lead to them having a rupture, which can lead to death. So masking the underlying problem with self-medication can lead to a worse outcome. Now, antibiotic resistance, and this is a problem that we are having very much in this part of the world. We are now seeing what we call superbugs. That is bacteria and fungi that do not respond to antibiotics. They have developed what we call odeshi against antibiotics and antifungals. Why are we having this? Is because people are misusing antibiotics, they're not taking the right dosage. Somebody's going to a party and they just decide that they need to take tetracycline and flagyl for no reason, and when they do that, eventually when they do need this flagyl and tetracycline, the bugs have developed resistance because they took a lower dose, which are selected for very strong bacteria, and so it no longer works. Also, dependence. In many cases, you have people who are dependent on analgesia. People are dependent on painkillers, or some people, they take steroids because of the symptoms they are having of pain and function without taking some steroid medications every day, which leads to dependence, substance abuse, and eventually adverse reaction. So you have people just taking these drugs even when they don't have any pain. For it now becomes a case of drug abuse. Then the major one that is so life-threatening is adverse drug reactions. Self-medication can lead to kidney, skin, liver, and prolonged use. So these are examples that we see almost on a weekly basis in the emergency rooms. paracetamol can cause liver. Paracetamol are harmless, or so to speak, harmless Panadol. Can you hear me? I'd say my internet connection is unstable, just to be sure I'm still audible.
We can hear you, but you were breaking at
Hello?
it. We can hear you now. Go ahead.
Okay, so sorry. All right. So the self-medication, these are classical scenarios that we see on a weekly basis. And I'm not joking. Every week there is 1 or 2 or 3 of these cases in the emergency rooms. Paracetamol that we think is harmless. If we take too much of it, it can shut down the liver. And you know, when the liver fails, that's the end. We don't have liver transplants in Nigeria. So if the liver fails, that's death. And so, you know, paracetamol should be used with caution. If a person takes too much paracetamol, it can damage their liver. The same thing with what we call non-steroidal anti-inflammatory drugs, NSAIDs. These can lead to bleeding in the stomach, because they erode the lining, the mucous lining in the stomach, and so the acid that our body produces can now digest the stomach, and this can lead to bleeding. And this bleeding can be life-threatening too. It's a medical and surgical emergency. And so people have to be very cautious with just using Felvin, ibuprofen, aspirin, cataflam. These are examples of diclofenac. These are examples of NSAIDs that people self-medicate with that can lead to death. Then the drug-resistant infections, I will show you some pictures of what we see. Difficult to treat fungal infections because people have been using a lot of antifungal, antibacterial, these triple action creams. So now the bugs have, you know, developed armor, and they don't respond anymore to the treatment. You have to treat for long and different things, which also comes with its adverse effects. And then cutaneous drug reactions or skin adverse drug, the whole skin can peel off with the wrong drugs, the wrong combination. You know, it happens quite often. And this is one of the few emergencies I see in my specialty as a dermatologist. And people can actually die from a skin condition. And it's linked to drug use. Then for people who like supplements, too much of vitamin C can lead to kidney stones. Also, too much of calcium can lead to kidney stones. And this can be very harmful to your kidneys. And the use of all these cataflam, diclofenac, ibuprofen can also lead to kidney damage. Analgesic medications lead to kidney damage. And people who sometimes abuse drugs like pentazocine, painkillers, I've had cases of people developing tetanus because they are injecting themselves in a very unhygienic environment, and this is introducing infections and things into their skin. So these are very, very common conditions that we see. These are adverse effects of the use of steroid creams. When people are using these triple action creams on a daily basis, this is the end result. We have a lot of fungal infections, and not only on the skin, these things can now lead to diabetes, hypertension, and can damage the kidneys. Fungal infection, drug-resistant fungal infections, which are very difficult to treat, and they stem from the abuse of several antibiotics and antifungals. This is the cutaneous adverse drug reaction we call Stevens-Johnson syndrome, or TENS, toxic epidermal necrolysis, and this is as the result of certain drugs, self-medication, sometimes prescribed medications can lead to this. But in many cases that I've seen of this, I've seen people taking multiple medications, and this potentiates or increases the risk of developing this very life-threatening condition, and usually it's with self-medication. Now, self-medication leads to chronic illness. As I mentioned, it can cause organ damage, which increases the burden on the health system. It's what people are trying to run away from. They end up spending more. So that consultation and hospital visits that you felt was going to cost you more, the adverse effects of self-medication will cost more than, you know, that cost you were running away from. And then also, when people hear that this drug causes this, it causes mistrust. People will not say that, oh, they were self-medicating. They will just hear that, oh, they used this drug and this happened to them. And so people will now say, don't use that drug. And they don't have the full picture, the full story. So how do we prevent, or how do we deal with self-medication? I would say it starts with health workers. First, we always need to be cautious with how we prescribe medications. And we also need to educate use of medications and the risk of self-medication. We have to let them know that self-medication can lead to a lot of devastating conditions. And, the more we educate people, the less likely they are to continue, because most times this thing come out of a place of ignorance, or lack of knowledge gaps with patients. And again, enrolling with health insurance will help, because if there is health insurance, they won't be running away from the hospital, because they won't be thinking they're going to pay. Health insurance, people will not need to pay out of pocket. And so they won't feel bad coming to the hospital. We also need to encourage restriction to prescription only medication. The problem we have in Nigeria is people can just buy anything. And so we need to encourage our pharmacy colleagues not to sell medications without a prescription. Pharmacy is often do not, but sometimes people working in the pharmacy may not have options. And then we also need to have community sensitization. Very important. Community sensitization. Then for individuals, when everyone here listening, my advice would be always consult a doctor for diagnosis and treatment of serious or persistent symptoms. Even in adverts, they will tell you, if your symptoms persist for 2 or 3 days, please see your doctor. Please take that advice. Don't self-medicate for 1 week, 2 weeks, or keep going. See, the pharmacists are meant to dispense medications and also help doctors to navigate drug interactions. But pharmacists are not meant to prescribe most medications. They are meant to prescribe over-the-counter medications. But where you need a doctor's prescription, you should see a doctor. Don't just walk into the pharmacy and buy antibiotics without any doctor prescribing them to you. And you take the medication as prescribed by your doctor and as directed by the pharmacist. Then you want to be careful with even the harmless over-the-counter medications. As I've mentioned, paracetamol is not as harmless as many people think it is, and many supplements can lead to problems if they are overused. Don't share medications with other people. If you have medications that have worked for you, it doesn't mean that you should ask your family member to use the same thing, because the dosage can vary, the condition may be different, even though they have similar symptoms. There are some medications that are contraindicated in certain age groups or certain genders. So you can't just copy and paste your medication to somebody else. And then you need to prioritize your mental and physical health. Get enough sleep, eat well, engage in regular exercise to maintain a healthy lifestyle that will reduce your need for self-medication. Eat a balanced diet with fruits, vegetables, lots of water. All right. And then if you find that you are dependent on a medication, that you really need to keep using it, like some people say, as I wake up, if I don't use this prednisolone, I won't be able to do anything. That's a dependence. You must seek help with a doctor if you find yourself dependent on any medication. And for policy makers, I would recommend that we strengthen healthcare systems. Universal health coverage, that is health insurance for everyone, is going to reduce self-medication and the adverse effects of it, because people won't be afraid to come to the hospital or health center because of the costs that they will incur. And we must promote health education and literacy in the media. We need to do more health promotion to educate people about the risks of self-medication and where it is appropriate and where it is not. Then we should stop this drug markets. It's only in Nigeria that you see people hawking drugs like they are hawking sweets. Well, in other countries it happens, but it's more rampant here, and there are some drugs that should only be restricted to pharmacists and not just to anybody that has a business. Selling drugs should not be a business. It's a calling for pharmacists to do. And so we need to have better control, regulatory control about access to prescription medications. Then we also need to engage traditional healers so that we can update our knowledge. I believe there is a place for traditional medicine, but it needs to be upgraded and also regulated. The Chinese, the anti-malaria we are using in the world it was once a Chinese herbal and now accepted worldwide, that is artemisinin-based therapies. We must also regulate media and influencer adverts because sometimes these adverts are wrong. I saw an advert on Instagram where people were recommending clobetasol as a cream for beauty. Clobetasol is the strongest steroid and it's not a beauty cream. But there are people on Instagram advertising clobetasol containing creams as beauty creams. Such things should be regulated because they are going to cause problems for the people who believe their adverts and buy those creams and use them as beauty creams. And of course, all our agencies need to work together, and we also need to help them to support them to reduce self-medication. We need a lot of engagement, and what we are doing now is one of such things: public awareness and engagement, school and community education, involving religious and traditional leaders, using the mass media and social media responsible, and promoting evidence-based skincare and health and medication messaging is very important. So in conclusion, self-medication is a major public health issue globally and in Nigeria, and both oral and topical misuse carry significant risks. We need a multi-sectoral approach to address the challenge of self-medication. Individuals should seek medical advice before using medications. Health professionals need to educate the patient public about the dangers of self-medication. And policymakers need to strengthen drug regulations and ensure public health engagement on the dangers of self-medication. That's my talk. Thank you very much for listening. If you need to contact me, these are my connections, maybe on Instagram, on LinkedIn, and I'll be happy to take any questions at the end of the talk or after the two talks. Thank you so much.
Dr. Folakemi, what can I say? Thank you so much. It's been a very informative 25 minutes. And I have to just raise my hand here and say I'm guilty. It's very sobering for me. While it's informative, it's also very sobering because I've had multiple instances where I've gone to the hospital for upper respiratory tract infection, and the doctor would have given me medications, and then maybe 2 months later, when I have cough, I go right back to the same thing without going to the hospital. I just take whatever antibiotics he gave me 2 months ago and I drink it, right? It's a very sobering conversation or talk that you've given. And I'm hoping that all of us here on this call are reevaluating our everyday health choices. And it may just be as simple as the laziness of getting into Lagos traffic to go to the hospital. Most times, it may not be that we lack the means. It's just saying, I've been there, I've done that. And I'm sure that it's the same cough that happened. Let me take the same medicine, or it's the same stomach ache, right? But it's very sobering. It's a call to action for us to reevaluate choices. Again, from very basic things. You've talked about Panadol, just basic taking Panadol. So it's from how we treat headaches to how we reuse medication without the doctor's input, like I have consistently done. So thank you very much. I have taken quite a lot of insights from what you said.
Absolutely. You mentioned something key here, Doctor. You said, while self-medication might seem like a shortcut, but it often leads to deeper health problems. I would also like to mention that not taking medication, the medication regimen they tell you to take this drug one morning, one evening for 3 days, and you don't take it, you take the first day, you don't take the second day, it's still tantamount to drug abuse. And that itself leads to a bigger problem because you can have drug resistance. So I think we should all take note of these things.
Absolutely.
Yeah. So if you're just joining us, just right in time, we're about to move into the second presentation for the day.
Thank you very much, Gordon. I think just as a summary or just as a recap, welcome to the guys who've just joined us or who joined in the last 10. We're having this seminar today, and again, our topic is the hidden dangers of self-medication and drug abuse. We have, again, data speaks to the fact that this is something that's happening. We've operationalized, or we've just made it a everyday thing where we pop pills because we know or we've heard that it works. Our first speaker, Dr. Folake, has taken us through, and very clearly, with very easy to understand conversation, what happens when we do that, right? So if you're just joining, welcome. Our next speaker is Dr. Kaine, who will be addressing yet another very, very pressing issue, which is the consequences of drug abuse on our physical and mental health. Dr. Kaine is a healthcare leader and expert in family medicine, in lifestyle medicine, and public health. And today she'll be sharing more information and shedding light on how drug abuse, whether it's through prescription misuse, through recreational drugs, or through substance dependency, it doesn't just harm your physical body, but it takes a toll on your mind, it takes a toll on your relationships and your future potential, to be honest. Because what we do today is a precursor to what is coming tomorrow and in the future. That being said, let me welcome Dr. Kaine. Doc, are you here? It's time. Welcome.
Yes,
and good afternoon.
Good afternoon, Mrs. Sowari, and thank you, Dr. Fola Kemi, for your presentation. It was really very apt and down to earth. And thanks to our audience also for listening keenly. Please confirm you can hear me.
Yes, we can.
Yes.
Okay, right. So I'll be taking us through the second part of this webinar, and I'll be speaking around drug abuse and consequences of drug abuse. So the primary goal is to raise awareness about drug abuse and its consequences on our physical and mental health. We'll be discussing the definition of drug abuse, the burden of drug abuse in our society, especially Nigeria. We'll also be looking at the causes of drug abuse, why people abuse drugs, physical and mental health effects, social implications, prevention, treatments, and we'll conclude with a call to action. So when we hear drug, what do we mean? A drug is a substance that causes a physiological or psychological change in an organism when consumed. And it's any chemical that can aid in diagnosis, treatment, or prevention of disease or other abnormal conditions, and could be taken either for the relief of pain, suffering, or to control or improve any physiologic or pathologic condition. By that, we mean disease or illness. So you take a drug either to aid diagnosis or to treat a disease condition. So today we are mainly talking about what we call psychoactive substances. So this is any substance that has the ability to alter cognition, that is our memory or our thinking, also alter our emotions and our perceptions because of its effect on the brain's, what we call dopaminergic pathways, and we'll see what that means as we go on with the session. Basically, the same thing I've talked about here, psychoactive substance use is a maladaptive pattern, so wrong pattern of use characterized by continuous use despite knowledge of having a persistent or recurrent social, occupational, psychological, or physical problem that is caused by the use or recurrent use in situations where it is physically hazardous. So someone is using a drug in a maladaptive, in a wrong way, and the person knows that with constant use, persistent use, it's causing some social problems, it's causing occupational problems, it's also causing psychological problems, but continues to use the drug. Now, we want to just distinguish between misuse and abuse, but suffice it to say that they are a spectrum and one usually would lead to the other. But misuse is usually unintentional, just like Dr. Folake had talked about. Self-medication could also be classified as misuse. But when we talk about abuse, it's usually intentional, and the substances that are used are illegal. So substance abuse has to do with illegal medications or drugs, as you call them, and they are not intended to be taken at the point in which they are being taken. Then associated with substance use is what we call dependence or addiction. And this could be described as a cluster of behavioral, I've talked about this, cognitive, physiological conditions that can develop from repeated use. And it's characterized by a strong desire to take the medication or the drug, impaired control over the use, and persistent use despite harmful consequences. And the person who is using the medication, higher priority is given to the drug use, and this leads to neglect of other activities. I've talked about this. Now, what are the drugs that people will commonly misuse and or abuse when we talk in relation to substance abuse? Alcohol, very commonly used, and it can lead to dependence. Then we have cannabis, which is often used for recreational purposes and sometimes perceived as harmless, but increasing doses of the medication would lead to catastrophic health consequences. Prescription medications like opioids, something like morphine, also benzodiazepines, that is Valium and its the medications in its group, are prescription medications that commonly are abused. So someone, I mean, you can buy Valium over the counter in Nigeria, but I'm not sure that it's not the case outside of Nigeria. I don't know of any other countries where you can walk into a store and ask to buy Valium. So again, we had talked about, Dr. Folake had talked about our policies and regulations in Nigeria. You can agree with me that this is really causing deleterious effect on our health. So on the right side, we see commonly abused substances and their common names. Some of us really need to study the common names so that we know when we have people around us who are talking of these things, we know what they are referring to. So these are the common names of some of the medications or drugs that are commonly abused in our society. So I'll take us through the Nigerian situation, which is a bit peculiar. As of 2016-2017, about 14.3 million adults aged 15 to 64 years used at least one psychoactive substance, and this excludes alcohol and tobacco. And out of these 14.3 million people, 20% have substance use disorders. That is the complications or the features of substance abuse we refer to as substance use disorders. And this figure exceeds the global average by 11%. Now, 1 in 5 of the persons that use these psychoactive substances use them by injection. So they inject themselves using needles and syringes. And also remember that they could share these needles and syringes with their cohorts because people usually abuse drugs in groups. Again, Nigerian situation, it's been found that 14% of the world's population is attributed to people who abuse or misuse tramadol and cough syrups containing codeine. So Nigeria ranks almost highest, one of the countries with the highest number of people that abuse tramadol and cough syrups containing codeine, unfortunately. And the number, so out of the 14 million people I had talked about earlier, about 3 million have serious drug use problems and need to be in treatment. And this number is likely to increase to about 4 million by 2030. Again, it's interesting to note that we have the highest level of ingenuity in substance use in the world, with the use of complex mixtures and unimaginable substances. And this has become a major challenge in drug use prevention and treatment. I'm sure as I'm speaking, we are imagining what happens, that people not only use one substance, they use a mixture of substances and things that you can never really imagine will go together, but all these are used in our country. So another thing concerning substance abuse is the type of substances that are commonly abused these days. Initially, we had the conventional drugs that were being abused, things like cannabis, marijuana, and the likes. But currently we have synthetic drugs. So the conventional drugs are actually natural substances. Most of them produced from plants. So opioids, for example, are known to be produced from plants and other naturally occurring substances. But synthetic drugs are chemical derivatives of conventional drugs. These are man-made products that are designed to mimic or copy the effect of the existing conventional drugs. They are referred to as designer drugs or lethal highs and have been found to be about 30 times more likely. People who use these synthetic drugs have been found to be 30 times more likely to visit the emergency department in emergency compared to those who use conventional drugs. And these are the top 4. So I have the top 4 commonly used synthetic drugs in Nigeria: methamphetamine, Colorado, also called spice. Then we have tramadol. I've mentioned tramadol, and the benzodiazepines, that is diazepam and its cohort. So these are 4 commonly used synthetic drugs, especially in Nigeria. On the right side, you see other medications that fall into this class of synthetic drugs that are commonly used in Nigeria. So this was a study done among 210 individuals in 3 groups, among people who use drugs, law enforcement agents, and public health professionals. And they found that this proportion of people actually used methamphetamine as that's the top, and then Colorado, as I've said, tramadol and benzodiazepine. So we have a problem with these synthetic drugs, especially in Nigeria today. Now, if you look at this slide and compare synthetic drug use in 2017 and 2024, you can see that in 2017, for methamphetamine, we have 0.6%, but by 2024, it's risen to 38% of people who use these substances. Please confirm you can still hear me. I just had a light out here.
Yes, we can.
All right. So we can see the change from 2017 to 2024 in consumption of synthetic drugs. Now, age of initiation, we have more people starting to use these drugs between 16 and 20. That's the highest age of initiation in this cohort of patients that were studied. Now, why do people use drugs? What's the psychobiology of drug addiction? So people usually start using medications for casual reasons. They want to ameliorate stress, they want to relieve stress or pain, and for social reasons. Oh, I'm a social drinker. And they gradually progress to using the medications or the drugs occasionally, so once a month, and move on to regular use every day, every few days, and eventually you have problematic, risky, or addictive use. So let's know that humans, we are naturally motivated to engage in activities that will generate feelings of pleasure. So things like sex, eating food, these are things that generate pleasure. So psychoactive substances also act in this way. They are behaviors that activate the brain reward system. I talked about dopamine, and dopamine is a hormone it gives a high. There's a pleasure that it gives when the dopamine, what we call dopamine receptors, are activated and gives a pleasurable high. So psychoactive substances also work on the dopaminergic system, and there's a reinforcing behavior in which a person develops that high and wants to experience it again, and now has to go for a higher dose of that drug most of the time, what we refer to as tolerance. So there's the tendency there's that, yes, tendency for the person to want to have a higher dose to get the same effect. And that is what now causes the dependency or addiction. So this becomes a major motivation for continuing use. So risk factors for drug use, I've outlined some of these, but I just want to mention a few that I've highlighted. So enhanced sexual drive, people use drugs, these are risk factors. People want to enhance their sexual drive. Stress, we have students who may be preparing for exams. There are several causes of stress. People want to relieve anxiety, want to relieve stress, and so they think that they can get that high from using psychoactive substances. Then more energy to increase productivity, especially for those who are working in the working class population. So you have people who feel that they are fatigued and want to increase their energy, and they decide that they have to turn to psychoactive substances to increase energy. Again, people who are depressed and have mental health issues, they feel that by taking these substances, they will get a high, and this would take them off their depressive state. But we'll find out that it's actually a vicious cycle, because when you use drugs for depression, one can also get depressed by using medications. Again, social media, Dr. Folake had talked about social media and the influence. We have people who advertise these medications, and there are others who also do not find out why or how these medications work and want to use the medications. So what are the causes of drug abuse? Why do individuals turn to drug abuse? Peer pressure, especially among adolescents. There could be mental health challenges that lead them to want to take drugs. Curiosity or experimentation. My friend is using it, let me try. And even from the first dose, some could have adverse effects from just using the first dose of these substances. Then lack of education on the drug effects. I talked about stress, and then we have cultural and media influences. We go on now to physical health effects. Substances that are abused could, especially alcohol, could damage the liver. Just a moment. We could have alcohol damaging the liver. We have what we call alcoholic liver disease, where you progress from what we call hepatitis. You could have hepatitis. There could also be liver cirrhosis, where the liver is actually, we know how liver looks, but the liver becomes fibrosed. You have a thicker tissue that replaces the soft looking tissue of the liver, and that's because liver cirrhosis, and can progress to liver failure. And then we also have kidney dysfunction. It can affect the kidneys, leading to chronic kidney disease, I beg your pardon. It can affect the heart. It can lead to irregular heartbeat, what we call arrhythmias, and this is a cause of sudden death in some individuals. High blood pressure and complications of high blood pressure are also some of the physical health effects of substance abuse. Now, respiratory issues affecting the lungs, particularly with inhaled substances. The lungs can be affected by substance abuse. Malnutrition, it can cause weakened immunity, and it can also cause chronic fatigue. Someone is perpetually tired, and this can also predispose to using the drug as an enhancer to improve energy levels. Other effects on the central nervous system, on the brain, you can have convulsions, can also have strokes, and organic brain dysfunction. Psychosis, that is acute psychosis, where we have some form of irrational behavior, people presenting in the A&E with features that are not understood. Sometimes, again, when people present with psychosis like this, they're actually taken to a spiritual house and not the hospital, because it's thought that it's spiritual. Most of the time, or almost all the time, it is a medical condition. Sexual dysfunction can occur as a physical health effect, infertility for both male and female, and it can also cause birth defects. So a pregnant woman who is abusing drugs can lead to birth defects in her unborn child. Now, hormonal imbalance can also occur as a physical health effect. There could be movement disorders and increased risk of infectious disease, especially HIV and hepatitis B. You remember the picture I showed where we had someone injecting medications, and I had talked about sharing of these needles. It can lead to HIV and hepatitis B. And there are other types of hepatitis that are blood-borne. Now, suicide and death from accident, very important, very common, because people who abuse drugs, substance use disorders, they are engaging in risky behaviors, and they can have accidents, and this could lead to death. Now, what are the mental health effects? Increased risk of depression. I had talked about depression as a risk factor. It also has a mental health effect when when substance abuse occurs: anxiety and suicidal thoughts, hallucinations, the belief that something is there when it's not there. People see things that are not supposed to be seen or others cannot see, and delusions, especially with some of the substances we call hallucinogens or marijuana. There's also paranoia. People that exhibit various degrees of paranoia when substances are abused. Cognitive impairments, not able to concentrate, poor memory, and poor attention or limited attention span can also occur. Behavioral changes like aggression and withdrawal can occur in people who abuse substances. The next we'll talk about are the social implications of substance abuse or drug abuse. Family, it affects families. Let's remember that drug abuse is disruptive to family functioning. And imagine a father or a mother who is dependent on a drug. This would negatively affect the development of the children, and it would also affect the cohesiveness of the family for the children. Again, imagine a teen or a young adult who has drug issues. It can strain relationships between parents and children. It can affect family finances. And you have people borrowing money to eat. You have people borrowing money to fend for themselves. So these are some of the social implications of drug abuse or substance use, crime and insecurity, and loss of productivity at all levels: local government level, state level, and at the national level. So how do we prevent? What are the measures? What are the strategies that we need to adopt to prevent drug abuse? First of all, for the families, individuals and families are encouraged to have open communication between parents and children. We should be observant as parents. When we see our child behavior is changed, a child who is outgoing now becomes withdrawn, we should ask questions. We shouldn't even wait for that time before we ask questions. We should find out what the children are doing per time and be positive role models to our children and to those who are around us. Gone are the days, yes, we used to say that it takes a community to raise children, but I don't know whether that is the case today. But we should look out for each other. It's an encouragement for us to look out for each other, look out for our children. So we should be positive role models. There should be mentorship, especially, I dare say, for males, because studies have shown that males engage more in substance abuse than females. I think a study showed that 3 times, when you have 3 times, the ratio is 3 to 1, male to female, for those who abuse substances. So we would encourage our male folks who are on the call to please be positive role models, mentor the younger males, mentor females, our female colleagues also mentor females. Mental health support and stress management, yes. So some people have talked about stress as a coping, stress as one of the risk factors for people who abuse drugs. There should be stress management lectures in the workplace, stress management activities in the school. There are various things that children can do, young adults can do to take their mind off the need to engage in these harmful behaviors of abusing drugs. So faith-based and moral grounding, also very important. For the government and for the community, we encourage health education programs in schools, community outreach initiatives, just as we're having now. We're having advocacy, and then drug testing policies in workplaces. Some studies, I didn't highlight that, but studies have shown that drug abuse also is very common among people who are working. In fact, the ratio of those who work to those who do not work, but had a higher ratio of those who work engaging in harmful use of drugs. So drug testing policies are advocated in workplaces and will be specific to the peculiar workplace. We should also strengthen policies. So we have policies against drug abuse, but these policies are not strengthened. We should strengthen policies and continue with advocacy. Now, what are the treatment options for someone who is found to have a substance use disorder? It's a medical condition, not a moral failure. So we shouldn't look at people who have these issues as not part of the society. With the right support, we know that recovery is possible. And available intervention, there are rehabilitation centers. I know of the Freudian Center in Lagos. We also have some other centers, Tranquil and Quest. If you know someone who is struggling with a drug use problem, please, it's important.
Sorry, Isi Meme, can you mute, please? Please mute your mic, Isi Meme. Sorry about that, Dr. Kaine.
Yeah. All right, just to round up, available interventions for people who are struggling with drug use problems. We have rehabilitation centers. There's offering of psychological counseling and therapy. There are also support groups and faith-based and community-based reintegration programs. We just need to also take advantage of your healthcare provider who will point you to the right place to where to seek help. Let's reduce the stigma so that more people can seek help. Remember, I had said it is a medical condition, not a moral failure. People turn to drugs believing that they will get some respite, and then they end up being addicted or hooked up with these drugs, and it affects their physical and mental health. In concluding, I would say that drug abuse poses a serious risk to our physical and mental health, and its impact ripples through families and society. Prevention is possible through education, vigilance, and a supportive environment. Let's advocate for a drug-free generation through compassion, community action, and sustainable health systems. Thank you very much for listening. And yeah, you can connect with me on LinkedIn, and I'll be happy to connect with you also. Thank you very much. And back to you, moderator.
Wow, thank you so much. What a sobering and deep, insightful presentation. Dr. Kain, thank you very much. I just want to also add, for those that didn't hear, cigarettes and shisha smoking is not that it's not part of it. Cigarette smoking and shisha is also linked with cancer, especially cancer of the lungs. So we should take note of it and not think that, oh, she did not mention it. She just mentioned it's a 25 minutes presentation. She couldn't have said everything. So let's take that into consideration. Also, one thing that have struck with me from the presentation is that drug abuse is not done in isolation. It affects the family, the workplace, and the community. Going through this presentation, I could clearly remember a classmate of mine that was doing very well, had a pharmacy, a very big pharmacy in Abuja, and years later, talking about she's begging for 2,000, 3,000 naira, all because of drug use. So we should take these issues very seriously because it affects all of us. It affects us in the way that if it affects your brother, your sister, your neighbor, you would have to contribute to try to see that that person comes back to normal physiological states. So at the end of the day, we are all wasting resources. We are all, our emotions are also involved. So it's a very serious matter. Thank you. Ms. Suare. Ms. Suare, you're muted. Ms. Suare, can you hear us? I think Ms. Suare is having a bit of network issues. Let's just give her a minute. There's also the early warning signs, which are often ignored and misunderstood. That is why conversation like this is important, so we can spot out the dangers early and take meaningful action. So right now, we are now heading to the Q&A session, and we we have already received some few thoughtful questions in the chat. If you have been holding back, now is the time. Drop your message at the Q&A session and we'll try to get as much as we can. And remember, no question is too small. If you are thinking about it, someone else is probably thinking about it too. So let's learn together. So can we see some of the questions? The first question is someone is asking if these slides can be shared via email.
Yeah, I can see a question. Can you hear me? Hello.
Yeah, go ahead.
Yes. So one question here says, in case where I don't have money to consult a doctor and I am sick, what do I do since I can't see a doctor? So in most primary health care centers, right, there is no consultation fee. You may just need to buy a card, which is very little. And even they have medications that can be given freely. Like in some primary care centers, you may be able to, if you have, for instance, if you do a test and they diagnose you with malaria, they may give you a free anti-malarial treatment that may be available. So I would still say, before you spend money going to buy those medication, try and seek a medical professional first. You may think that it's, taking more cost, but it's a cost that might save you a lot of future costs if you decide to just go and buy medications in the pharmacy without having a proper diagnosis. So yes, there is often a cost for seeing the doctor, but in a lot of public health facilities, that cost is very minimal. Primary health care centers, and even general hospitals, before you see the doctor, the cost is quite minimal. So I would say, please do try to do that rather than go for the drugs first, then you don't get it right, then you still have to come back to the doctor and see them, and then you buy drugs again. So you're going to end up spending double, in some cases. If it's a mild thing that you feel maybe you just have a little flu and you take something and it gets better, then that's fine. But if it's something that persists for more than 2 or 3 days, please, it's better to see a doctor. And then another question here says, when there is resistance, what do we do? Now, that's where you also need to see specialists, experts. So they will do what we call culture tests, and they look for the possibility of any drugs, any medication, antibiotic that can work a little bit or can work to an extent. In most cases with resistance, the treatment cost is higher because the drugs that will be recommended maybe special drugs that are not readily available and they are more expensive. So we can see that, abusing drugs can lead to us having to pay more for medical care when the need arises, God forbid. But that can happen. So with resistance, they have to do a sensitivity test, and in most cases, they have to go to very high class of antibiotics or antifungals that are more costly and have more adverse.
Dr. Folake, would you also want to throw more light on the resistance as it affects can you hear me? Resistance as it affects the community. So the antibiotic resistance doesn't also affect the individual, right? So you may think that you're fine. I mean, am I not taking care of myself? I need to go and get the medication, for example. But, antibiotic resistance is such that it affects the community, affects your family members in a way. And I would explain it this way. Now, you take an antibiotic, you don't complete the antibiotic, and there is resistance. It's not just that you as an individual, you have developed that resistance, that antibiotic may also not work for the next person in the community, right? That's your family member, any other person. So it's kind of a head, it affects the generality of the population, not just the individual. And then it's also more difficult for pharmaceutical companies to even manufacture these antibiotics because the rate of resistance is even higher than the rate in which they manufacture antibiotics. So we find ourselves in a situation where we do not even have the antibiotics anymore that will take care of these super infections that come up. So we are in a very difficult situation in our environment, and it's something that we need help. I must say that we need help. We have people who are traveling out of the country, and for something very small, they have an infection, and the medications out there cannot even take care of common infections. You know, they can't take care of common infections. We have ampicillin, for example. Ampicillin doesn't work. We have amoxicillin, clavulan. It doesn't work for the majority of people. So we have to now look for more expensive antibiotics that are a sole preserve of some particular infections. Again, Dr. Falake had mentioned lifestyle and prevention is something we should really do so that we do not have need for antibiotics and other drugs that are commonly abused. So that's my my little addition there. Then there's a question that says, what's the difference between drugs and medicine? So they are almost always used interchangeably, but in some environments, the psychoactive substances are what will be referred to as drugs, while medicines are what is given when we have when we make a diagnosis of a particular medical condition or disease, as it were. So the semantics or the terminology is different, especially depending on the environment you find yourself in. So I know that in the UK, for example, when you say drug, then you may be in trouble. So it's better to use the terminology medicines. Thank you very much.
Thank you, doctors. I think just to encourage participants to please continue to drop your questions here. I don't think that there's no wrong or right question. If you're thinking about it, then it's a question to be asked. So please continue to drop. Dr. Folake, I have a question for you. So you know how during COVID and post-COVID, we used to drink ginger, garlic, cloves, we boil it together. And I think it's a behavior that I carried over. And now I find myself when I've had a very stressful day or when I feel some symptoms of cold, I'll just put ginger, garlic, black pepper, cloves together, boil it and drink it, right? And I don't, so the problem or the challenge with me is I use my hand as measure. I just take a handful or a few pieces, right? What do you think is the impact to my organs? Because sometimes the tea is very strong, sometimes it's mild, but I get a sense that I'm not doing my organs good. I'm not doing well with my organs. So,
well, in honesty, those things you mentioned are healthy herbs and teas. And in moderation, I think they are fine. So if you do take, once or twice a week, some ginger, garlic, cloves, and make it in a tea, and it's not like you're drinking this 3 times a day, every day, I think you're fine. They do have some beneficial properties. Like all medications, it's not the medication, it's the dosage.
right.
So it's when people, I know that cloves, if people take too much of cloves, it can be harmful to the health, right? So if you're just taking it as a tea once in a while, once or twice a week, I drink ginger tea too because I have allergies and just to clear my airway a bit, and I find it to be very soothing. And it's even recommended, for common coughs and cold and flus as first line. You can take ginger and honey with hot water, and they are helpful. So that's what we're talking about. Some self-medication remedies are okay. The challenge comes with if it becomes every day, or you twice a day, morning and night, you're drinking clove water, that's where you may end up having some issues. Some of these things affect the hormones. I know someone who grew ovarian cysts from taking too much of cloves, right? Because she
Right.
used to take cloves in almost everything, and so it must have affected her ovaries. So that's one thing that can, but most of these drugs is the adverse effects. It's the excessive use that leads to adverse effects.
Right.
But
Right.
if you do things in moderation, just like with almost everything, you're not likely to run into any trouble. So please enjoy your occasional ginger, garlic, and clove tea. I don't think there's wrong
Thank
with that
you.
in small quantities. Yeah.
Thank you. Thank you. I think that's very comforting because when I started hearing about unprescribed and the dosage and all of that, I was a bit worried that I was abusing. That was my own form of drug abuse in
Yeah.
my house.
Just think
Doctor,
moderation.
okay,
All
fantastic.
right.
Thank you. Thanks, Dr. Folake. Dr. Kind, I have another question for you. In your slides, there was something that was very, very sobering for me, which is you showed a graph that had the demography of people who, or individuals, or citizens who abuse drugs the most. And there was a demography of 16 to 20 that had 39% of drug abuse. As a mother of a teenager, that's very, very scary, right? I think my question is, what do you think is the driver for these types of drug related use, the increase in that? And what do you think will be the early signs? So early signs to detect that something is off, and what are the proactive ways to prevent? If are there any preventive mechanisms for that?
Thank you very much for the question. So I cast my mind back to the teenagers. Self-identity, they're in a stage where their identity means a lot to them. And they tend to, of course, these days of social media, they tend to hear these things from outside rather than reinforcement, positive reinforcements from home, right? So because they are struggling with identity, they could have some gender identity issues, their body looks, how they look and all that. So they are also coping with, they're also coping with things like bullying and all that. And so they may want to veer into drugs. I talked about experimenting. So they want to try it. They want to feel high. Someone may, they could have some ways of reducing their self-esteem and all that from their peers. So they want to experience the high and they decide to try it. So peer pressure and all that are also some drivers, for them to engage in substances. So what do we do in terms of prevention? Again, I had talked about observation. We really need to be keen observers of our children at home. And once you notice any withdrawal, any change in behavior, you need to ask questions. But before it gets to that point, we also need to educate them, be open and educate them about these substances, about peer pressure, about influences, external influences in any form. They have to be really proactive and not reactive. We as parents have to be proactive and not reactive. And the children also need to be, I'll say also proactive, because you could be taking a drink and someone has popped something into the drink and you may not know, and the child takes it and then comes down with the effects of substance use. So we need to educate them. Education starts from home and before they also get educated in school. So that's
That's
what I
nice.
would say about that. Yes.
If I may add to that, I think a lot of young people are very good at hiding things. And so you have to have a very close relationship with children. As much as possible, ask them, what did you do today? Know their friends, know what they're up to, what are the conversations they have. And sometimes you also have to be a bit of a nosy person, have access to their media, their social media, if they have any access. If they have a phone, you should be able to see everything that is on their phone, because they are very good at hiding things too. And in many cases, you won't really see the signs until it's gone, quite far. But if you have a relationship and you are able to let them know that I can talk about anything to my mom, and I'm not scared of reaching out to her. I'm not scared of she's going to flog me or she's going to kill me if she finds out I did something. and they are able to come to at a stage where, Mom, I went to this, we tried this, so I really messed up, but I tried this thing with my friend, and this is what happened. Then we can catch it and deal with it early. But if they are really scared, or they are not able to open up, or you think they are fine, and they're not showing you, this where how they really are, what they're really dealing with, then by the time you catch drift of it, it might be a bit late. So I would also say be an eagle eye over your children, and also talk to them. Let them know that no matter what happens, they can tell you about matter what, and that you're not going to judge them, or you're not going to castigate them. Then no matter what happens, they can tell you, and that will help. I think as well.
Thank you so much. Thank you, Dr. Kindly, for yours, and thank you, Dr. Folake, for your response. I think, yeah, it makes sense, because at the end of the day, it's the relationships that you have, even past being a mother, the relationships that you have with people around you.
You're muted,
Oh,
Mrs.
sorry. Yeah. Can you hear me now?
Yes.
Yeah, so I was saying that fostering conversations, fostering relationships, I think is very, very crucial. Just even beyond mother-child, your friends, your family members, people outside, because it's only when they know that, like you said, you won't judge them. That's when they're able to open up to you on what their challenges are. Dr. Folake, while I still have you here, there's another question, very interesting question, and it's about the dangers of energy drinks. So the Red Bulls and the Monster drink type things, what's the
Oh, yes.
effect, and how do we, I mean, the person who asked the question says, how can we stop the future effects of it? I'm not sure if we can, but what do you think?
Oh, you can absolutely stop the future
Hmm.
by not drinking it. So, but these drinks are very extreme. A lot of energy drinks have very high levels of caffeine. Sorry, am I audible? My network is
Yes, you are.
Yes,
fluctuating here.
yes, yeah.
But they have they have very high levels of caffeine. Now, caffeine in small quantities is known to be helpful, also in moderation, but in small quantities. But the amount of caffeine, like 20 times the required daily amount, or the expected amount that you're supposed to take of caffeine a day. If you have like 10 to 20 times that in a drink, that is going to take its toll on your nervous system. It's also going to create an addiction pathway. And then it can also have negative effects on your circulatory system, on the heart. So it's quite dangerous, especially if people are drinking lots of these drinks on a daily basis. There's also a chemical called, I think it's called taurine, that is present in these energy drinks in very high quantities. That's also harmful to the health. And notwithstanding, they are very high in sugar. So the combination of the sugar, the caffeine, the taurine, it's not a good combination. And my advice would be, if you must drink this, it should be once in a while, very sparingly, not on a regular basis. And that's the only way you can, prevent the adverse effects of this, which can lead to, problems with the heart, can lead to problems with the nervous system, difficult sleep, poor sleep. And poor sleep affects every other thing in our bodies, because it affects the way we metabolize, it affects, our immune system. Poor sleep can also increase the risk of cancer. So you don't want anything that is going to disrupt your sleep. And these drinks can. So my honest advice is, they should be classified as a substance, a bad substance, um, close to strong alcohols and cigarettes, and they should be used very, very sparingly.
Right, right. Thank you very much. While you're here, I still have you on the hot mic. Another question. So there's a saying that Google is your friend. Now, can we take that analogy into using a browser, a search
Medications.
browser?
But Dr. Google has led a lot of people astray. If you Google your symptoms, you always think you have cancer. That's the thing. No matter what
Mm,
you have, what you Google, One of the differentials would be that you are and will just give you unnecessary anxiety. But I believe that yes, education and researching your symptoms is important. But but the information of Google is not yet able to replace the consultation with a medical professional who is trained. It's a medical professional that will know how to sift out that information to make clinical diagnosis. So yes, you can read on Google, but it doesn't the need for you to be able to see an expert. And then you can discuss your concerns or what you read about with the doctor. Oh, I read that if I have this headaches on one side of my head and I'm feeling dizzy, it's nausea. I mean, it's with nausea, it's migraine. Do you think that's what I have? Right? But you have to have that conversation with your doctor and not just diagnose yourself and treat yourself, because that can lead to a lot of problems. You may get it right once or twice, but I mean, the time that you get it wrong can be really devastating. So my advice is yes, don't read too much. Some people say never Google your symptoms, but in this digital age, I don't think that is a practical advice to give. I'll say yes, read about what you have, but don't make a diagnosis from Google. Google is to enlighten you, and then so that you can have an educated and informed conversation with your doctor when you do see the doctor. So that you are going to run into trouble one day, and it might not be very good trouble. It might be very serious trouble.
Understood. Understood. Thank you very much. Dr. Kaine, I have one question for you. So we have a question here. The lady, I think, says that she used to use ginger and garlic a lot, and she developed ulcer, right? So now she only uses both of them when she's cooking. So she's asking, can she start to take both in a tea in moderation, and will it trigger her ulcer again? What are your thoughts there?
Very interesting question. So ulcer can be quiescent, right? So let me call it the resting phase. But when you take something that would directly affect it, it can open up again. So I would not advocate for a trial just to see if you have an ulcer. If you take something and you feel the pains, epigastric pains and all that, then you could know, okay, it's coming back. But I wouldn't advocate for taking that. You're taking it in your meals, so that's okay. It's unfortunate that it went that way when you were taking it in excess. I've also had a patient again during COVID who actually came into the emergency because of all the ginger garlic concoction. She just mixed it, and then the dosage was really outrageous, of course, out of fear. So I wouldn't advise that you take it just to see if you will develop the ulcer, so that you don't have a resurgence of ulcer. So it's okay, you're taking it in your meal, that's fine.
Okay, so if I understand correctly, she should not restart the tea drinking.
Yes, don't risk it.
Okay. Thank you, Dr. Kaini. I think we're about to round up. I have one question for Dr. Fola Kemi. And it reads here, recently we have many skincare personnel, I'm sure on social media, like you guys have said, who advise young people, mostly ladies, to use different supplements like vitamin E, probiotic gummies, and all of that for glowing skin. Are these all necessary? Can we do without them? And what are the effects of not taking these products? There's also a last question that says, is vitamin C supplements good to be taking on daily basis? And one last question, there's another one, maybe we just add all of them together. Is folic acid good for a lady to be taking daily without prescription? So I'll allow both of you to answer these questions. Thank you.
Thank you so much. Please be careful who you listen to on social media. Everybody has an opinion, but not everybody is qualified to give advice, health-based advice. I realize in Nigeria, once you talk confidently, people will just believe everything you say. You just need to say it with a lot of confidence, and people will believe it, whether it's rubbish you are saying or not. So please be careful. Google people that you listen to on social media before you take their advice. Are they qualified? Are they doctors? Are they dietitians? Are they registered dietitians? Are they nurses? Do they have the required qualifications to give advice on health-based or even skincare? For skincare, are they dermatologists? Are they trained estheticians? Not just someone that likes beauty and decides that she's now an authority in all things skincare. These are the challenges we have. But because the person looks nice and talks confidently, people swallow what they say hook, line, and sinker without, questioning it. You don't need supplements. If you eat a healthy diet, rich in fruits, vegetables, healthy oils, healthy fats, you do not need supplements. Even the vitamins that are in supplements are usually in synthetic forms that are not easily absorbed by the body. They are better absorbed in their natural forms, which are in food, in fruits and vegetables. Where supplements came in is because people are not eating healthily. We are meant to eat up to 5 portions of fruits and vegetables a day. Most people don't eat that way, especially in Africa. We eat carb heavy. We eat a lot of carbs and less of the vegetables and the fruits. But if you are able to change your diet to eat healthier, more vegetables, more fruits, lean fats. What I talk about healthy fats, avocado is a very healthy fat. Fish is healthy fat because you do need some fat for your body to function normally. And the omega-3 fatty acids that your body needs are found in oils and fats. So nuts, avocados, important. So if you eat all those things, probiotics, you don't need to take probiotics. If you eat iru, or if you eat ogiri in your food, or if you eat ogi, pap, even gari, they are all fermented foods and they contain probiotics. So probiotics is not necessary, you don't necessarily have to take probiotic capsules. Even yogurt, yogurt is made with bacteria in the milk, and that lactobacillus is a bacteria, and that's what's in a lot of probiotics. So just eat yogurt, with fruits, and you're good. So I'm just saying that supplements are not necessary. Now, some people believe the supplements they are taking it their skin. If you are taking supplements to enhance your skin and you are eating junk food, you are drinking fizzy drinks, and you are eating pastries every day, you are wasting your money. It's better for you to eat healthily, and that will help your skin and not take supplements. The supplements cannot overdo or cannot erase what a bad diet has done. Do you understand? That's the perspective. But sometimes we get busy and we're not able to get enough nutrition from our food. We can add a supplement to it. And if you have certain vitamins that we may prescribe for a given period of time, when it comes to vitamin C, vitamin C, too much of it can leave you with kidney stones. The body cannot absorb more than 300 to 400 milligrams of vitamin D a day. So why are you taking 2,000? You're just giving your kidneys more work to do. A lot of people take 1.5 to 2 grams of vitamin C. You are overworking your kidneys because your kidneys have to now excrete and process the rest of the vitamin C. And if you're not drinking enough water with that, you can develop kidney stones. So if you want to do vitamin C, not more than 400 to 500 daily is what I would recommend with lots of water. And that's fine. But if you are doing 1 gram, 2 gram, it's too much. Most supplements are not necessary. Some people are not taking collagen for their skin, and you're just giving your kidneys more work to do. There's more pressure. If you can eat collagen from chicken, from bone broth, from your food, meat, water, when you cook with those things will give you the collagen, the bovine collagen that people are now packaging as drugs and are taking as supplements. So it's a marketing gimmick in many ways. And let's not fall for the marketing. If you can eat healthily, yes. Again, supplements in moderation are fine. Folic acid is important for women of reproductive age, particularly if you're married and you know that you could get pregnant at any time. Taking folic acid is a good idea because you want to have enough folic acid for the baby to form properly in the first few days, of conception. So I don't think there's anything wrong with a woman of childbearing age taking folic acid on a regular basis. Hope I've answered that. So I'll leave Dr. Kaide
You answered
for
it.
her thoughts.
I'm guilty of collagen, but I hear what you're so guilty of that. Dr. Kaine, do you have more insights to share?
So for folic acid, I think I had typed in the box where it was said the question is without prescription. Yes, for women of childbearing age, it's fine, but that's there's no indication and you're taking folic acid every day. It's not a prescription. I mean, you don't have it on that for a prescription. So it's not, you don't need to. Yeah, but Dr. Fola, I would like you to throw more light on someone asked a question, and it's really very important around the trend of skincare and organic substances. It's an epidemic now in our environment.
It's a big problem. And if you follow me on social media, I'm always on Instagram, Fola Demadoc, trying of the advertising of these skincare products that are harmful, because when they've bought these skincare products and they've damaged their skin, I would say frustrating seeing the damage that people have done to their skin with these organic skincare products. And a lot of them, there's nothing organic about them. Organic means, oh, they're like plain raw materials, they're not processed, they're natural. So if you want organic product, buy coconut oil and buy shea butter and rub on your body. Why do somebody have to mix it for you? Because those ones that are mixing it, they're mixing in bleaching agents into them. We've tested some and found steroids and hydroquinone in them, organic products, So we need to be very careful what we buy. I was even sad. There was a mother who bought organic products for her baby of 6 months old, and the baby came with frank steroid-induced skin complications, and she bought these skincare products for her baby off Instagram. I mean, why would you do that to an innocent baby? It's so sad. But again, as I say, once people speak with confidence on the internet, everybody just believes what they say, and a lot of people are not sincere. So if you must do organic products, and I use shea butter. I have dry skin on my feet, and I use shea butter on my feet a lot. It works very well. You don't need anybody to mix the organic skincare products for you if that's what you really want. By the time they are mixing it, they're mixing other things into it that are harmful to the health. And so I don't advise people to patronize people selling organic or natural skincare products. Sometimes you need some preservatives in skincare products to prevent them from growing bacteria. Otherwise, those skincare products will end up giving you an infection. Because unless you are going to be buying your skincare product every 2 or 3 days, it has to have a preservative so that it doesn't grow harmful organisms. And so those preservatives have been tested and been found to be safe for the health. So you have to balance it out. Having products free of chemicals and preservatives is not sincere. We are, as human beings, we are chemicals. We are made of hydrogens and carbons and sulfur and many chemicals too. So people saying they don't want to use things that have chemicals is quite a little bit ignorant, if I may say. And so these organic substances, people are preying on the ignorance of people to sell bleaching creams in disguise. Because when I tell them use plain shea butter, they say it will make me dark. Oh, so it means you know that this one is going to lighten your skin, and that's why you want to use it. So we need to be sincere with ourselves about these things, and also be very cautious about where we buy things that we put on our skin, because some of these things can, have very serious adverse effects to the health and the body. And the same with all these triple action creams that we buy. Oh, I have this spot on my face. I'll just go to the pharmacy and buy that triple action cream and be using it or be rubbing it on my skin when I have a rash. They cause more harm than good. So let's be
an
very
example of
careful.
triple action cream, Skinil, for example.
Yes, Kindle from Bacteria, Epiderm, all those, those are those creams that people just buy. They have very high potency steroids that are not even meant to be used for people under the age of 12. And you find some mothers using it for their newborn baby. They are contraindicated under 12, like Roberta saw. But somebody is using skinny from back in a 6 months or 7 months old baby's skin cream and using it for them. That is going to get absorbed into their bloodstream and can lead to growth problems with the child. But most people don't know these things. They just think, oh, it's going to make my child's skin fresh. And so we need a lot more education about skincare products and things, particularly for children. I'm particularly worried for children. For adults, if you spoil your skin, you know, we can try and we'll tell you whether it's fixable or not. But with innocent children that haven't even had a chance start at life, and you know, the mother has inadvertently given them health problems because of skincare products, it's quite concerning. So please, the petroleum jellies, the Pierce baby lotions, and the things that we used as babies, please go back to those things. You don't need any toning, fair anything for your babies or for yourself. And you don't need organic products for them, please. Those things, in 90% of the cases, are going to cause more harm than good.
So we thank you very much, our speakers, Dr. Folake and Dr. For a wonderful presentation that you have done for us. And we are very happy. We are excited. We are more informed about the things that you have told us. And we hope that everyone will put this into practice so that we can get better. So as we wrap up this session, there are a few points that I'd like to put across, which is one, self-medication is not always safe. Even the common over-the-counter drugs sometimes can cause harm without guidance. So it's always good to go to the hospital or see a healthcare professional to prescribe these drugs for you. Drug abuse is not just only hard drugs prescribed, prescription drugs that is misused, drugs that antibiotics given to you, take one morning, one evening for 5 days, and you decide to take one morning, one evening for 2 days, and the symptoms are gone and you decide to stop it. That is drug abuse also. So sometimes it seems like it's the big words, but there are some little things that we do that can actually be drug abuse. And thirdly, mental health is health. The mind, the body are deeply connected, and any harm to one affects the other.
Thanks, Gordon. To the ladies, Dr. Kemi, Dr. Folakemi, and Dr. Kaini, thank you so much. I, for one, I thought I knew stuff, but I have learned quite a number of things that I take for granted. And I want to say a very big thank you on behalf of Pistis Foundation. And I dare say on behalf of the participants of this webinar, you guys have been outstanding. Thank you for sharing your knowledge so generously. To all the participants, thank you for your time. It's a weekend today, but you've taken out 2 hours to be with us here and share in this knowledge sharing session. Thank you for taking the decision to invest your time in learning. And I think one of the key takeaways here is to remember that the first step to changing your life is to change your mind. There are a few things that have been said here that is quite thought-provoking, and that I'll go back and start to reorientate my mindset. So I hope that everyone also takes that out. We don't expect to see very drastic changes. The changes start when we start to rethink the way that we process and understand things. And I think based off the conversations that have been had here, we've taken that step today. Another encouragement that as Pistis Foundation will give the participants here is to keep the conversation going in our homes, with our children, like Dr. Folakemi said, within our communities, because it's only when we know better that we do better, right? I would also really, really advocate that we follow both doctors on their social media pages. What we'll like is the continuity of information, right? So they have given us they've shared their wealth of knowledge with us, but I think if we go and follow them on the social media pages, it also helps so that there's that continuous stream of information that helps us to do better. I think that's that, but until the next time. So Pistis Foundation, just as a recap again, we typically do these webinars on different themes, right? This session, it's drug abuse, it's self-medication. Please stay informed. We will be sending routine emails just to keep you informed of when the next webinar is going to come, or we can even send you tips to help you stay healthy and be proactive about taking care of your health. Until the next webinar, please stay informed, follow our doctors on social media, stay safe and stay whole. Panadol for once in a while headache is fine. Please don't be like me who takes prescriptions when a doctor prescribed 2 months ago or 3 months ago. It won't kill. I think it's just extra effort. See the doctor. Google is your friend to some extent, right? You can research your symptoms, but ultimately you must consult with a doctor before you start to take medication. I think that's again.
I like that.
Big
Google is your friend, it's not your doctor.
Yes, 100%. So thank you again to my co-moderator. You've been outstanding. Thank you so much. And I'll say we all have a good evening. If there are no other questions or comments at this time, I think we can call it a wrap and have a good evening ourselves.
Thank you.
Any other questions?
Thank
Okay.
you.
All right, guys. Have a good one. Cheers. Bye.
Good day.
Bye.